Hi, Denise. How have you been?
Hi, I'm okay. I mean, we're here, so
Yeah, okay. I haven't seen you in a couple of weeks, so just wanted to catch up and I thought maybe we can start on just seeing what's been going on. You said you were all right. What's been happening this last week?
um I mean, it's just been pretty stressful, like I
Hmm.
got a new job, right? So starting that and going through the training process is always a hassle. So just been a little overwhelming for me.
Yeah, yeah. What kind of job did you get?
So I do casework now. Yeah.
Okay, okay, awesome. So you feel like the training has been kind of overwhelming?
A little bit, yeah. I think it's just because they like gave me my caseload immediately and were like, here's your 12
Mm.
clients. This is a brief overview. So like I only get like an hour of training a day and then I'm left off with my clients. So it's been pretty intense.
Yeah, that sounds intense. That sounds like really, really overwhelming. Something that would overwhelm me as well.
Yeah.
With all this going on, do you feel like your new employers have been very supportive of your training?
They try to be, I would say, but it's not the best. I think because everybody's caseload is pretty high, we're all just kind of, you know, surviving.
Right, right. And I mean, that can be difficult to start feeling so early on into your job. I think we go into jobs feeling really excited and really looking forward to getting in the rhythm of things, and to have it so overwhelming from the jump and kind of stay that way, would be really difficult.
Yeah, I mean, you know how it is with my anxiety, right? Like if I have no guidance, all of a sudden it's just like, ah,
Yeah, and guidance is so important and honestly so needed. Like, it would be kind of crazy not to feel overwhelmed and not to feel anxious when being thrown into a position that you don't feel prepared for.
yeah, thank you. I feel like when I've tried to talk to others about it, they're just kind of like, well, it's a new job. So thank you.
Yeah. And I think it can be really overlooked, especially when we are so new. People just say like, "Oh, you're just starting. It'll get easier. It'll get better, right?" And that might be true. It might get easier the more you get trained, but to be thrown in and starting to see clients, I've talked with you for a few different sessions before and seen how much you care about your work and how much you care about your clients, that I could imagine it's really stressful to be put in a position where you don't feel prepared to provide them the service that you normally would be capable of doing.
Mhm. Yeah, it's been a lot. I feel like I try to give my best some of these days, but other days it's just like, I don't even want to get out of bed.
Yeah, yeah. So how much longer do you have of training?
They're putting us through 4 weeks, so I'll be done with week 3 and start week 4.
Okay, all right. So you're kind of halfway there, almost.
Yeah.
A little more than halfway, actually. Okay. So I want to just kind of bounce back to something you said earlier, is that you're having a hard time getting out of bed. Which I think we see happen with burnout in our workplace, but um, also sometimes just in general when we're not in good headspaces, and especially when we don't feel very supported. Um, with all of this going on, have you been having any thoughts of suicide?
I don't know if they'd necessarily be thoughts of suicide. It's more like I I'm so tired. Like if I were to just stay asleep forever, that'd be great. If I didn't have to wake up, I wouldn't mind it, but not like I would actively want to do something to hurt myself or to kill myself.
Okay, okay. So you don't feel like you've gotten to a point where you're starting to fixate on thoughts of suicide or wanting to make a plan?
No, I don't think so right now. I think the reason I scheduled a little earlier than usual with you was because I started noticing like I was lacking so much motivation, and then having that thought of like, well, if I don't wake up, I'll be okay with it. That really scared me.
Right. And those kind of thoughts can be really scary. They can make us feel like even more anxious, like, oh my gosh, why is my head going here? Right. And like, why am I thinking these thoughts? This is not normal.
Mhm.
And we can recognize it. So I want to just acknowledge that I know that that took a lot of self-awareness, and I'm really proud of you for making this appointment and for taking initiative for your mental health and knowing when things are off, because self-awareness is a skill that is learned a lot of times. And I know that probably was not a very easy thing for you to do, to acknowledge some of those thoughts. Um, I want to also ask too, have you been having any thoughts of self-harm?
Um, Nothing too intense, but I did start noticing that I like if I have like, a pen, I'll like start scratching myself when I get really anxious just to kind of, you know,
Mhm.
cope that way and take my mind off things. Or like if I have like a scrunchie or a claw clip, in my hair, I'll like, you know, put the band up against my wrist and do that.
Mhm.
Or like scratch myself with the claw clip. So like not very intense things, but like it seems to be a way that I'm coping.
Yeah, yeah. Have you ever self-harmed before?
No, this is pretty new behavior. I mean,
Okay.
I know I get anxious, but like to the extent where I'm like unconsciously hurting myself now, that was also a lot for me to like come to terms with. I was like, whoa, like I'm scratching myself, like I'm actively self-harming.
Yeah. Yeah, yeah. That is new for you, right? From you mentioning that. Um, when you have these, when you start to notice that you're self-harming or doing something like that, why do you think that you're doing this unconsciously?
I think it goes back to just being overwhelmed, right? So like when I notice that I have no breaks in between my caseloads, right? And I have to go like back to back with clients, or, like they disclose some pretty like difficult or traumatic things that can be triggering for me. Like it's like automatic behavior, right? Because obviously I don't want to like stop the session with them and be like, hey, like
Yeah.
that you need to stop. Like it's not very professional to do.
Yeah, yeah. So, you mentioned the anxiety before. Do you feel like this kind of falls under that anxiety realm of um, do you notice yourself doing it when you're feeling more anxious? Because it kind of sounds like when you have a big caseload or when you're feeling extra tired and needing some of that awareness or energy to work with another client, which is so challenging. Client after client after client gets so exhausting, and we want to put our 100% in, but it's just not possible when we're doing so much. Do you feel like this self-harm is kind of in the realm of anxiety?
I would say so.
Okay. Um, And I want to bounce back really quickly. Have you ever attempted suicide before?
No.
Okay. Okay. So these kind of thoughts of you having lack of motivation, getting out of bed, or not wanting to wake up to the next morning, are really new for you.
Yeah, I mean, I don't think I've ever experienced anything to this intensity before, so I was caught off guard like pretty quickly. Like I think within those 3 weeks of that training, as they escalated, I was like, whoa, this is definitely new.
Yeah. Oh my goodness, yeah. And another question I just want to ask just to see where your head is at. Have you had any thoughts of harming anybody else?
No, no,
Okay.
never.
Okay. I didn't think so. I just wanted to check in with you, see kind of where you're at. So something I like to do with people, when they feel like they start to kind of head into this headspace and they want a way to be able to pull themselves out of it, is what I call a safety plan. Have you ever heard of that before?
Briefly, but not too much.
Okay. So basically what it is it's like a plan you make for yourself where you walk through these moments. So hopefully it can be something you turn to when you start to have these feelings of not wanting to wake up, or maybe recognizing that you're self-harming and wanting to do something about it, or pull yourself out of that headspace. And it gets you into hopefully a safer spot, or hopefully a position where you have resources that you can reach out to help and kind of take that next step. Would you be willing to make one with me today and I can kind of walk you through it?
Yeah, yeah, that would be great actually.
Okay, perfect. Do you have a piece of paper and a pen, or actually, here I have one. You can write it down.
Thank you.
Okay, so I want you to title it Safety Plan. Actually, you can title it however you'd like, but a lot of people title it Safety Plan. Other people do it Plan B or Emergency Plan, things like that. However you would like to do it. What feels most comfortable for you?
I would say safety plan just until I get like used to the idea of what this tool is and that I have it.
Okay, perfect. And I'll mention too towards the end, but we will most likely revisit this because sometimes our crises change and like what overwhelms us changes, right? And your job is going to change over time and there's going to be different stressors. So it's important to revisit it and re-update. And that's totally normal and really, I think, healthy to do because we always need a backup plan, right? So, okay, so I want you to title this first section Warning Signs.
Okay.
Okay. Now, I want you to think of some of the warning signs that you can notice within yourself when you start to get into this headspace that you've been mentioning to me. Can you think of anything specific?
I think probably like my anxious tendencies, right? So when I start noticing that my breathing is getting a little more intense, or, like I start fidgeting with my hands or shaking my leg, I think.
Okay. Yeah. Yeah, those are great ones. Do you want to write those down?
Yeah.
Okay, perfect. Now can you think of anything else?
Um, Probably like I've noticed when I have too much caffeine in the mornings, right? More than my usual. I already come in with a lot of anxiety and a lot of energy from all that caffeine. So maybe that.
Okay. Yeah, so too much caffeine in the morning? Okay, that's a good one. Okay, can you think of anything else?
I don't think so. That's the only thing that comes to mind right now.
Okay. So I'll kind of I like to do this just to get help people brainstorm. And the reason I do this is because I've noticed that sometimes we have warning signs that we don't even notice. They're so unconscious. They happen without us even recognizing it. And then before we know it, like boom, we're feeling really, really overwhelmed. And I do this by thinking of warning signs in three different categories. The first one is physical, and you mentioned some of those physical ones with starting to notice maybe our hands start getting sweaty or our chest starts racing or getting tight. We get a headache or a stomach ache, things like that. Can you think of any other physical warning signs that you can notice within yourself?
I mean, now that you mention it, probably the headaches. Like I notice
Yeah.
I'll start getting migraines a little more frequently. And then that's
Yeah.
usually when I start having those thoughts.
Yeah, yeah, definitely. And I think sometimes when we're just tired and overworked, you're just sitting in a stuffy room talking to somebody and you start getting that like little back of the head headache. And that sometimes can be a warning sign of like, hey, I need to slow down, like a red flag. I need to take a minute for myself. The other category is emotional warning signs. And people see this a lot with um, crying more often, or being more short-tempered or irritable, or some people isolate a lot and start to kind of noticing themselves backing away from people or doing things more on their own. And then anxiousness is an emotional warning sign too that you already noted. Can you think of any emotional warning signs that kind of relate to you?
Probably, probably the sadness, right? With a lot of these new caseloads that we've taken on, right? How
Mhm.
it's based on a lot of volunteer work and working with, a lot of low income communities, they're very sad background stories, and having to hear that all day, I feel like when they're pretty intense, right? And I am feeling pretty down after work, I start going into that mindset of like, okay, well, if I go to bed and I don't wake up, I'll be okay.
Right. It starts to build up.
Mm-hmm.
Really overwhelming. Yeah, that's definitely a warning sign to write down. Kind of just that, what's the word? I can't think of it, but um, maybe like existential, is that the right word? Like when you just feel like everything is too much and we can't really fix much. That feeling of really overwhelming work that it all is just weighing down on us. And we do good work, right? You do good work. And but that also means that you're carrying a load of a lot of different people's hurt. So to recognize when that starts to weigh on you more than normal is really important. Um, Now this last section of warning signs is mental. And a lot of people see this in like negative self-talk. And I tend to think, at least for myself, that mental warning signs are the ones that really put us into a dark place of um, because we start to question and kind of beat ourselves up over our character and who we are. Some people are very critical of their self-image, but other people are very critical of their quality of work and their quality of being a mother or a wife or a daughter. And we start to blame ourselves for different things that are going on and being very critical of ourselves. Can you think of any mental warning signs that you feel like have been affecting you recently?
Um, I mean, I don't think so. I don't know if this would count, but I think like I strive to be, like you said, right, that like a good wife, that good person, that good worker, that good friend. So I
Mhm.
kind of always just put my needs towards the end. And sometimes I'm like, oh, why do I do this to myself? Like I should know better. So kind of like I don't think shaming would be the right word, but kind of just, like
Mhm.
reflecting on that myself, like, oh, why didn't I do this? Or like I should have taken lunch. I don't know why I didn't do that. Or like I
Yeah,
talk about self-care, but I never practice it.
yeah, definitely. Do you feel like those types of feelings show up more frequently before you start to get into this headspace of self-harm or suicidal thoughts?
Yeah, for sure.
Okay. Yeah, I definitely say that's a form of being critical of ourselves and how we're treating other people. It sounds like you're very critical of yourself on how you treat the people in your family. Um, because sometimes we can be very confident in our work and how we treat our clients, but then be so exhausted by the time we get home that we don't feel like we can give that same enthusiasm or energy to our family members. And that can be, I think, an area that we kind of pick apart and analyze and can beat ourselves up for. So I think that's a good one to write down. Okay, do you feel confident with this section? Do you feel like you've kind of hit the nail on the head with some of these warning signs?
Yeah, I think with you like offering a lot of examples definitely helped me realize that I have a lot more warning signs than I had thought.
Okay, perfect. I'm glad to hear that. So let's go on to our second section, and this section is called coping skills. Um, Now, I'm sure that you're familiar. We've talked about coping skills within our own sessions, but this also can look like distractions. So some people like to put coping skills slash distractions as their title. But this is going to be some things that you use to cope when you get into this headspace. Have you found anything helpful to kind of get through this?
Definitely going on little walks when I have time in
Yeah,
between work, in between sessions, like even if it's just going up and down the block, like just catching that fresh of breath.
definitely. Yeah. And I think going on walks is a great way to not only just like get a change of scenery sometimes than our office or wherever setting you work in, but also for the fresh air and for the exercise. And all of those things can be really beneficial to us. Can you think of anything else?
Definitely being able to go to the gym after work is
Hmm.
huge. But then I think I can get self-critical at times when I'm too tired to go.
Hmm.
So it's kind of like an iffy one for me.
Okay. Do you feel like that would be something beneficial to put on your safety plan or something that would be more harm than good?
Um, I think maybe putting it in my coping skills, but also maybe adding it to my warning signs, just so that I can kind
Okay.
of keep that in mind.
Yeah, I think that's a really great idea. Um, okay, can you think of anything else?
For sure, working on my deep breathing, right? Especially when I like start noticing my breaths are getting shallow, like being
Hmm.
able to regulate that way, like that's box breathing that we've been working on in the past
Yeah.
sessions for sure helps a lot.
Okay, I'm glad to hear that. That's my favorite one too. And so I always tell people about it and I'm glad it works. I know it's not, breathing exercises are not for everybody, but I'm glad to hear that that's helping. Can you think of anything else?
I think just being able to talk to my friends and my family, right? Not maybe not about what's going on all the time, but just kind of
Yeah,
hearing that safe voice is always
yeah.
nice.
Definitely. And I think friends and social supports are a great coping skill to have. And you're actually jumping ahead a little bit because that's one of our next sections is social support. So feel free to put them in this section, but then we'll also kind of go in a little bit more depth in that in the next section, okay?
Okay.
So how do you feel about these coping skills? Do you want to try and brainstorm some more? Or do you feel like these might be helpful just have written down?
I think these are pretty good because these are things that I'm already doing, right? And it's just like being able to notice those warning signs and say, okay, let me take a step outside and
Yeah,
just practice my breathing skills outside as I'm like going up and down the block.
yeah, for sure. Yeah, I think that's a great idea. Um, and I want to kind of bounce back to something you said earlier that you, as well as a lot of your coworkers, are just surviving. You use that word surviving. Um, and I think that that feeling of being just like burnt out, of like kind of dreading your work and barely really getting through um is really common in the workplace, but can be really harmful to our mental health. And something I like to talk about with a lot of people is self-care. And I know that word is frequently overused with a lot of our work, but what I mean by that is making sure that we're eating enough food, and drinking enough water and hygiene, right? Showering and washing our face or changing our clothes and then sleeping. Do you feel like any of those areas are something that you've been struggling with when you've kind of fallen into this headspace?
Definitely sleeping. Like
Yeah.
once I get into bed, I feel tired, but then I notice my mind is just racing on all these things I could have been doing to take like better care of myself, which, is ironic being that I can't sleep and rest.
Hmm. Yeah. Okay. So how do you feel like you can, um, or what kind of things have you found to be helpful to help you fall asleep?
Melatonin gummies
Okay.
have
Yes.
been
Really?
great.
Okay. Do you feel like that's something you can put as a coping skill of um like nighttime routine?
I never thought of that, but that might be good.
Okay. Is there anything else you feel like might be helpful to try as a coping skill to help you fall asleep and get into the rhythm of this nighttime routine where you can shut your mind off and really get the rest that you need?
We talked about this a couple sessions ago. You brought up mindfulness. We didn't go too much into it, right? It was like a brief
Mhm.
introduction, but I think maybe like discussing that a little more and seeing if that could be a good practice.
Okay, yeah. I think we can definitely start getting into that and diving a little bit in. I'm a big fan of mindfulness and I do use it to help me sleep as well. So that might be something that might be helpful for you. So I will write that down and we can start working on that as well and make sure to cover that in more depth and hopefully be able to incorporate that into your coping skills section. So thank you for bringing that up. I think that's a great idea.
Yeah, of course.
Um, okay, so do you feel like that kind of covers the basis of what can be helpful for you in these moments that are really, really difficult?
Yeah, I think we have a pretty good list. And like you said, right, we can always add to this if I feel
Yeah.
like things aren't working or I want more things to try.
Okay, great. Yeah, I agree. I think you've done a really good job of making this list of coping skills so far. So now let's go on to our next section, which I like to call reasons for living. And this section tends to be a little bit more difficult for people because it's a huge question. It's super overwhelming. Like, what are your reasons for living, right? But um, can you think of anything right off the bat that you would put in this section?
Yeah, definitely my friends and family, right? They're wonderful people. I aspire to be as kind and as loving as they are, and just, like being with them is just such a joyful experience. I wouldn't want to lose that.
Yeah, I think that's a great one. And family and friends are often a huge reason for living for most people. It's something that I think everybody can kind of connect on. And I know you mentioned you didn't have serious thoughts of suicide, but even for I think the average person, reminding themselves of why life can be good is a great reminder to help us keep moving forward and having the motivation and inspiration to want to keep going. So I really love that. Okay, so this next section is going to be our social supports. And this is kind of like what you touched on earlier. But I want you to first think of some of the people that you would feel comfortable with talking about your mental health and finding support in. Can you think of anyone in your family or friends that might be a safe place for you to do that?
Yeah, actually, one of my coworkers, she's been like a huge pillar for me there, and she's always checking in and kind of asking me like, "Hey, like how are you? Do you need to talk about anything? Like I'm here to help you process." So she's been awesome.
Okay, I'm so glad to hear that. Okay, so I would write her number one on the list. Um, And then from here on out, I want you to think of just some of the social supports that you have in your life that you could go to just for support in general, right? And this doesn't need to be someone that we're going to go to and talk about all of our hardships and those deep emotions, but someone that might just make us laugh or tell us about their day so that we don't have to focus on ours. Can you think of anyone you would put in this section?
Yeah, definitely my sister. And then, I mean, I told you I always try and be a great wife. So my husband for sure, he's always like telling me the funniest things, and he's a great distraction.
Okay, good. Yeah, those are great people to have on the list. And again, too, I just want to remind you, like these plans change with us. And so sometimes our social supports look different, or sometimes, hopefully, more good social supports come into our lives that we can add to this list. So when we revisit this, we'll always want to touch on that and see who else we feel like we could find support in and add or take away from this list. Okay. So this last section is titled Professional Supports. And this is going to be kind of a list of different support systems professionally that you can reach out to if you feel like you either need that support or I want to kind of discuss if you don't feel like you can keep yourself safe, what we can do from there. Okay. So right off the bat, can you think of who you might put in this section?
You, for sure.
Okay, good. Yes. And we also have our therapy center's emergency line. So I can give you that phone number as well that you can write that down. And then you have my contact information. Um, Another one too that I always think of is like the hotlines, the suicide hotlines, the crisis hotline. Have you ever used any of those before?
It's funny. I recommend a lot of, the families that I work with to
Mhm.
reach out to those lines, but I've never reached out to them myself.
Okay. Well, I used to actually work for those lines, and I loved working there, and there was a lot of phenomenal people that worked with me that are really good at just providing that immediate support and having someone to talk to. And sometimes, like those late nights when everyone else is asleep and we don't feel like we can reach out to anybody, I always say that they're a great one to reach out to because it's the middle of the night and they're open 24/7. So if you want to write their phone number down as well, that also might be a helpful resource for you.
Yeah, and that's just 988, right?
Yep, you can just call 988. Or sometimes there's like specialized hotlines. If you feel like you're struggling in one specific area, sometimes you can Google it. I could provide you a whole list of phone numbers, and I will do that at the end of the session. But sometimes just Googling like hotline support with um, anxiety. And there might be a specific hotline for those specific areas, or the main phone number, like 988, normally covers that as well.
Okay.
Um, Now let's try and think about what might happen or what kind of resources or professional supports you can reach out to if you feel like you can't keep yourself safe and you need that immediate support. Have you ever heard of the receiving center?
Yeah, again, it's something we always like provide as a resource for some of our clients, but I've
Mhm.
never been up there.
Okay. Would you ever consider going there if you felt like you couldn't keep yourself safe?
Probably. I mean, I've had clients come back and tell me that it's a good place to just decompress, and
Hmm.
the caseworkers there and like the crisis workers there were really great, and it was just a very validating experience for them.
Okay, good. I won't bug you further with describing what can happen at the receiving center and everything. I know that you know and you talk to your clients about it and everything like that. So I think you're probably well versed in this professional support section. But is there anything else you feel like you could put in this section for professional supports?
I mean, going to the emergency department is always a good one, right? Like that's
Yeah,
kind of our anybody's go-to, right? When we don't know what to do or when we're not feeling
yeah,
safe. So for sure that. And I think just my med provider, like that I take anxiety medication. So just
hmm,
kind of reaching out to them and saying like, hey, is this like a normal side effect or is this something that I
yeah.
should consider, you know, taking extra precautions with?
Yeah, definitely. And I am a big supporter of keeping your medical practitioners, your doctor, your psychiatrist in the loop of your mental health. That really can only benefit you to have them be aware of where you're at mentally and kind of what you're struggling with. Um, just because they fall under that whole scope, right? And so, yeah, I think that's a great idea. Okay. So this last section that I want you to think about is how we can keep your environment safe. And I know you mentioned you didn't have any active thoughts of suicide or any plan, anything like that. But we want to prevent you from getting to that point. Um, what kind of ways do you think you can make your environment a little bit safer? Most specifically, your home.
Probably, I mean, I haven't gotten to this like level of intensity with my self-harm, right? But just um keeping away from the sharps when I do notice that I'm in my
Mhm.
anxious tendencies. We don't have any firearms or weapons in the home, so I know I'm safe on that end.
Okay.
But yeah, I think the main thing would be just keeping away from sharps, right? Because if I
Yeah.
do have those scratching tendencies, I wouldn't want to get an urge to cut or to use something sharper.
Right. Right. And when you do start noticing that you're kind of using those things to scratch yourself, how do you think you can kind of make that environment safer right in the moment?
Um, Probably just like if I have like covers on my knives or something, it might, like take me a second to obviously take off the plastic covering. So it kind of just like
Yeah.
reflect on that. I'm like, oh, okay, like let's take a step back. What am I doing? Or keeping
Hmm.
them close to like by where my like fridge is, right? And my freezer. So instead of reaching for something sharp, reaching for an ice cube and kind of helping with that.
Yeah. Do you think that that's something you can put in your coping skills as well? Like reaching for an ice cube or something soft that you can squeeze or even rub against your skin or feel the texture of it when you get those urges to self-harm?
Yeah, that's actually a pretty good idea.
Okay, perfect. Okay, so that's your crisis response plan in its entirety. Is there any section that you feel could use some more work or you want to talk about more or um, maybe you're not so comfortable with?
No, I think you did really good at helping me, discover a lot of new triggers, a lot of new warning signs, and finding specific skill like coping skills for each one. So I thank you a lot for sure.
Yeah, of course. And on a scale of 1 to 10, how likely do you feel like you would be to use this?
Oh, probably like an 8 or a 9 for sure. Very much up there.
Okay, perfect. Now, I'm going to assign you some homework, and the only homework I'm going to assign you today is that you go and write this down in another location. Some people like to put it on their phones so that whenever they're feeling overwhelmed, they can just pull it up in their notes because who doesn't have their phone with them these days?
Sure.
Um, and that way we can kind of be aware of where we have it. Do you think that's something you can do?
Yeah, for sure.
Okay. And where do you think that you'll put this piece of paper when you get home?
I will definitely be putting it up on my fridge.
Okay, that sounds like a great place. And sometimes I encourage to like your husband's there, right? Like let him know what this is and let him know what's going on and if you feel comfortable doing that. And the more support we have that are of people in the know of where we're at in terms of like provide like getting support can be really helpful too. Um, okay, well, I'm glad that you came and you shared with me how you're feeling, and we can talk about it more next week, okay?
Yeah, of course. Thank you so much, Paige.
Of course, have a good day.
You too.